Hello, I'm Dean Whiting from Pathology Technology Australia. In previous COVIDiocasts, I've talked about the antibody tests and the PCR test, the swab test for COVID-19. Today I'd just like to talk a little bit more about the tests and especially what we're hearing about false results in some of these tests. Some people have referred to a Johns Hopkins University meta-analysis, which looked at multiple studies and showed that there was a reasonably high level of false negative test results for the swab test, the test that measures the viral genetic material, the RNA. The test itself is exquisitely sensitive. The PCR, polymerase chain reaction test, to detect RNA is very, very sensitive. So the technology itself is very reliable. However, what we do see is that results are dependent on when the sample is taken in the life cycle of an infection and the site from which the sample is taken during the infection. And this has a lot to do also with the prevalence of the infection in the community and also the index of suspicion within the individual from whom the sample is being taken. Index of suspicion might mean, are you completely asymptomatic and you have not had any contact with people or in surroundings that have demonstrated to have COVID-19, then your index of suspicion is extremely low. Your index of suspicion might be a little bit higher if you have had contact with a known case, or if you have symptoms. Then in that case, the index of suspicion is higher and a result can be differently interpreted. But if, for example, you have very low index of suspicion, you have no symptoms as such, there's no reason to believe you have COVID-19, but you've taken the test anyway because you can and it's been recommended. In which case a negative result is almost certainly a negative result. However, if there is an index of suspicion, such as you have symptoms or you have been in close contact, then a negative result may not mean negative. And the public health authorities are recommending that in such a case you isolate and you remain isolated, and preferably within 2 or 3 days take a second test. The reason for this is that if the virus is just infected into the nose and throat, the population of the virus, the number of viral particles might be quite low, and the swab may miss the location in the nose or throat, in which case the test will come up negative. Now, it's not because the technology hasn't worked as such. It has. It's done its job. But what it means is that the virus is not present in sufficient quantity, or the swab has missed the location of the growth of the virus within your nose or throat. So the important message here is the technology works perfectly well. It's a question of the timing of the sampling, and it's a question of the location of the virus in your nose and throat and whether the swab has picked that up. You may sometimes hear also about false positive PCR tests. Now, these are extremely rare, and false positives are very difficult to judge because we don't know if the patient really is positive. There's not a second test you can go to necessarily that will confirm a positive or not. So false positives are extremely rare. And once again, are possibly not due to the technology itself. The technology is extremely good at picking up positive cases. But rarely we find a positive in patients who have actually recovered and have remnant viral RNA in their body. In that case, the test is positive, but the patient has recovered. In very rare circumstances, patient samples are mixed up or contaminated, in which case the result is correct, but it's just on the wrong patient, or it's been contaminated from another source. So those are the reasons for the false positive and the false negative PCR tests. But there are also other tests that I've spoken about in previous COVIDiocasts, the antibody tests, or the so-called serology tests. There's also the antigen test, and you may have heard me talk about the antigen. It's the protein found in the blood which has been generated by the virus infection. And that antigen can be measured, and it can be measured very soon after the infection commences. So in the very, very near future now, very good antigen tests will become available. It would require either a finger prick or a sample of blood taken into a blood tube. And the antigen test will be able to confirm within about the same period of time an infection as a PCR test, for example. That's the antigen. Now, antibodies are derived in the body, in the human body, as a result of the antigen, not the virus itself. And so the antibodies are measurable from 7 to say 14 days after the infection takes hold. And the antibodies are directed against the antigen. They will find the antigen on the virus particle and kill the virus. And so you will resolve your infection over a period of 7 to 14 days, and your antibodies will increase over that time. Previously, you've heard me talking about the different antibody classes, the IgA antibodies, which are your immediate response antibodies, and they cause the violent reaction of sneezing in your nose and throat. Then there's the IgG and the IgM, the short-term and the long-term antibodies, which tell us that you're fighting an infection or that you have long-term immunity. These tests have been developed very, very rapidly over the last few months since the COVID-19 pandemic commenced. It's been an amazing job by the technology developers, and these tests are being improved all the time. We now have antibody tests which will detect with a high degree of accuracy between 99.9% and 100% accuracy in these assays now. So less than 1 in 1,000 false results associated with some of these antibody tests. And the multiple antibody tests are measuring slightly different antigens. So using several antibody tests will help determine the true picture in a patient, where one antibody may be equivocal or not measurable, a second antibody may be, in which case you can then make your diagnosis and monitor the effectiveness of the patient's response. I hope that's been helpful. I'm Dean Whiting, Pathology Technology Australia.